the more they are told what's in it. Now, I mentioned that Michael Tanner at the Cato Institute has a piece, and he says that Obamacare is now a bigger mess. He focuses on the Medicaid expansion. Now, let me summarize this, because it gets a little, or it can get a little complicated when it needn't be, because it uses terms that are a little nebulous, but I'll try my best. What we do here is make the complex understandable. The healthcare law, in order for Obama to get a score on the total cost from the CBO of under $1 trillion, shifted much of the new expense to the states. The healthcare law requires the states to bear the brunt of most of the costs of insuring all the 30 to 40, whatever million numbers of people that don't have insurance. And largely this occurs through the Medicaid program. Well, the states don't have a lot of money. The states can't print their own money. And the one thing in this ruling that might be seen as helpful is the court said that the states cannot be punished if they refuse to accept these new expenses. And what that meant was that the federal government, Obama, cannot take away their existing Medicare funds if they refuse to accept the demand of spending new amounts. So they can't be blackmailed. They can't be penalized. They can say, we're not going to accept this responsibility. You want to spend the money, you spend it. We don't have it, we're not. Now, having explained that, let me pick up with Tanner's piece halfway through. Here is another complicating factor. Most states have not yet set up an exchange. Let me go one paragraph earlier. Remember now, this is a law that already will cost as much as $2.7 trillion from 2014 to 2024. It'll add more than $823 billion to the federal deficit. And these are estimates that assume state taxpayers will be picking up some Medicaid costs. How will Congress react if billions or perhaps trillions of dollars in new costs are added to the federal budget because the states refuse to pick up the cost? There's another complicating factor. Most states have not yet set up an exchange. Many, especially those with Republican governors or legislatures, may refuse altogether to set up exchanges. By most estimates, as few as 15 states are likely to have exchanges in operation by the 2014 deadline. Now, the exchange is where you're going to go to get insurance. And we touched on this yesterday. If the states don't set up these exchanges, then where are you going to go? Well, by 2014, 2015, enough damage have been done to the private sector insurance industry that you won't have any option. You'll be forced to go to the feds. But it gets a little complicated there. Obamacare gives the federal government the authority to step in if the states do not set up exchanges. Obamacare gives the federal government the authority to step in and set up and operate an exchange in any state that doesn't set up its own. But there's reason to doubt that they have resources to do so in 35 to 40 states. Anyway, federal subsidies. This is the states subsidizing the cost of an insurance policy. Federal subsidies are available only through the exchanges that the states set up. The federal government cannot offer the subsidies through a federally run exchange. Thus, if states neither expanded Medicaid and if they don't set up exchanges, that could effectively block most of Obamacare's new entitlement spending. Now, this is theoretical because Obama wouldn't let that happen. He's not shown any concern about spending restraints anywhere. Well, under the law, there's only a certain amount of money budgeted for the law. Under the law, they may not have the money to set up the exchanges in as many states that will not set them up. The states, if the states do not follow and set up the exchange, that's what these governors are all saying, we're not going to play. We are not going to implement Obamacare. What they're telling you is they're not going to establish any of these exchanges that the law requires because they don't have the money to pay for them. And under the terms of the bill, under the terms of Obamacare, the costs that are in there, the states do not have the money. The feds don't have the money. They've offloaded it to the states for that very reason. If the states don't spend the money, the feds don't have it under terms of the law. Now, again, we're dealing with Obama, who doesn't care about law. I mean, this was a lawless decision. His amnesty for the Hispanics list, well, that was lawless. So I'm just giving you, if everything happened according to the law, we would have a very interesting situation. But the law doesn't matter to the people who are running the show right now. And I don't know how to say it other than that. I've got no interest in lying to you about this. Bottom line is that if the states neither expand Medicaid or set up these exchanges, that could effectively block most of Obamacare's new entitlement spending. Because according to the law, and don't ask me why, I don't know, according to the law, the federal government can only offer subsidies in state-run exchanges. They can't offer subsidies in an exchange that they set up and run themselves. I don't know why. All I know is it's what the law says. I don't know what the thinking is behind it. The obvious question is, why would the federal government penalize itself and allow itself to be put in this position? I can't answer that right now. I don't know. Just telling you what's in the law. There's one last wrinkle. If it is the subsidies, it's the subsidies that trigger the penalty or the tax, whatever you want to call it, under Obamacare for employers who fail to provide workers with insurance. So states which do not set up exchanges could also escape the employer mandate. That is, Obamacare requires employers with 50 or more workers to provide health insurance or pay a fine. A tax, whatever you want to call it. But the tax only kicks in if at least one employee of the 50 qualifies for subsidies under the exchange. And I don't know what you have to do to qualify for a subsidy, but it ain't much. Because they want everybody to think the government's giving them health care. So it isn't much. And all it takes is only one employee out of the 50 qualifying for subsidies to have the tax kick in. Now, since the subsidies can only be provided via a state-authorized exchange, a state that refuses to set one up could end up blocking the employer mandate altogether. And this is what the governors are trying to say without saying it. At the very least, expect some employers to sue on this point, leading to yet another Supreme Court challenge. This is nowhere near over, but I want to make one more observation. Look at what I just said. Everything I just told you is in this stupid bill. How many of you know what the heck an exchange is? Okay, tell me, what is it? It's the DMV. You are going to go to the healthcare DMV to get your insurance. What in the world are we talking about here? A state-run exchange, 50 employees, but if one qualifies for subsidies, then a tax, and there are 2,700 pages of this gobbledygook. State-run exchanges. I'll tell you who's doing hoops in the grave is Karl Marx. So think of this. Well, and I know some people are going to get insurance and some won't, of course. And the reasons that some get insurance while others don't will become known as well. And those who don't get insurance, well, don't worry, pre-existing condition. If you get sick, then they show up then. How many people with a pre-existing condition are going to show up thinking that for the first time they're going to get insurance? The law says they get it. But who are we dealing with here? We're dealing with a bureaucracy. You get diagnosed with a very serious disease. I don't even want to think about this. This is an absolute disaster. It is an unmitigated disaster that is so un-American in the sense of tradition, the way things happen in this country. A state-run exchange, and then whether or not there are subsidies, and if the state set up the exchange, then the feds can subsidize, but if the feds set up the exchange, there can't be a subsidy, and if there isn't a subsidy, then somebody isn't getting it for free, and you, the American people, aren't going to be able to keep up with this, so whatever you're told at this freaking exchange is going to be your life. All you want is an aspirin. All you want is a doctor to examine you, find out what the heck's wrong. Why are you sick? In the meantime, you're in a government office going through hoops, trying to figure out if you qualify to even be at the exchange. Not even fully understanding what one of those is. And at the end of the day, it all doesn't matter, because the whole point of this is to have this control over you, is to have this authority over you. It's break time, and when we come back, we'll get to your phone calls. I'm going to reward people who've been patiently waiting since the program began. Even before that, they've been lined up. So that's coming up next, right after this, folks. Sit tight. The EIB Network, Open Line Friday on Tuesday, rolls on.